Hi guys, welcome back to another video of HUA channel. So today we will be discussing a simple topic about lymphoma or lymphosarcoma. So hypercalcemia is one of the very evidential feature in T cell lymphoma. So T cell lymphoma and B cell lymphoma are mainly based on the immunophenotyping. So hypercalcemia is one of the main feature. So why hypercalcemia we will be dealing in this video. So if you haven't subscribed this channel yet, feel free to subscribe and hit the bell icon. So canine lymphoma is actually a malignant neoplasm arising from mainly the lymphoid tissues, and it is one of the most common hematopoietic tumors in case of dogs. It affects mainly lymph nodes, spleen, liver, bone marrow, and extranodal sites such as GI tract, skin, eyes, and CNS. So the main reason behind hypercalcemia in case of T cell lymphoma is actually due to production of parathyroid hormone related peptide. It's actually a paraneoplastic syndrome, and due to the production of parathyroid hormone related peptide, it is called as PTHRP. And again, second main reason is cytokine mediated osteoclastic activity. So the first reason, neoplastic T lymphocytes often produce PTHRP, which mimics the action of parathyroid hormone. So what happens in case of parathyroid hormone? They actually lead to bone resorption, and from the bone the calcium comes into the circulation. And again, what PTH does? Calcium reabsorption from the renal tubules, so reduces the renal phosphate reabsorption, and the phosphorus will be comparatively less, and the calcium will be comparatively high. That lead to hypercalcemia and hypophosphatemia. So again, the next thing is actually main due to the tumor cells and associated inflammatory cells releases IL-1, IL-6, TNF alpha, and TGF beta. These can also induce osteoclastic activity along with PTHRP. So the next one is actually decreased renal excretion. That is again a second feature of PTHRP. And the T cell lymphoma have a higher tendency for paraneoplastic syndrome compared to the B cell types. So the T is terrible, which rules partly becomes the aggravative biological behavior and frequent metabolic instances like hypocalcemia, which is very evidential in T cell lymphoma. So the clinical consequences are PUPD, muscle weakness because of loss of calcium from the bones, anorexia, vomiting, and constipation because of reduced phosphorus, and possible AKI because of the excess and prolonged hypercalcemia. Thank you.